Good afternoon. Marcus Gordon here at the Bombastic Podcast with Michael Meucci from Arcadia. As CEO of a healthcare data and AI company in this day and age, what does that mean? Because every company has AI built into their capability set.
It's a good question. What does it mean?
Yeah.
No, for us, I think a little trip back in time helps contextualize what we're doing today.
Okay.
We started the business 15 years ago to help deliver on the promise that EHRs were making, which was how will care become more consumer-centric, more data-driven, more efficient, cost-effective, and high quality. And we have viewed our role over the last decade and a half in the healthcare ecosystem as helping to amplify the impact of all of the transformative technology that we're implementing.
Right.
How do you measure the impact? How do you optimize that technology? How do you monitor and track its safety and efficacy? And that calling has never been more relevant than it is today. You walk the show floor here at HIMSS, you read any of the healthcare press roll-ups, there is a new AI skill, capability, application being launched every day.
Yeah.
And all of them are designed to meaningfully improve the way that care is experienced, delivered, the way that it feels to deliver that care.
Absolutely.
And we have that happening amidst a backdrop of a couple of pretty macro headwinds that I think are really important. The first is just increasing cyber threats. The threat actors are more sophisticated. They have AI. So you have that. So how do you implement these AI solutions safely, securely, rapidly? You have compressed margins on the health plan and the hospital system side. And so you have a lot of pressure on the healthcare system. And they really need this AI to work. So the question becomes, how do you implement it quickly? How do you measure its impact quickly? How do you know when to bail out of something that's not having the right impact?
Yeah.
And that's not a criticism of any vendor. Sometimes it's a criticism of the implementation of the system, of how they can change.
Right.
And so when we think about our work today, it's about bringing together trusted, complete, timely, and relevant data sets that will help make these AI solutions as effective as they can be. You think about the early days of AI, people talked about hallucination all the time. We don't hear much about hallucination.
Right.
It's because the knowledge base has gotten better. And as you start to apply and develop and deploy AI solutions inside of health plans, health systems, they need that knowledge base.
Yeah.
And we are, for a lot of our customers, the single largest aggregated point of all of their clinical and claims records. So they have the full longitudinal context of a patient journey. And that helps us really accelerate that impact.
You mentioned a key word, trusted, and something which Dr. Hansen and I discussed earlier today is trust and efficacy, at the provider clinical level, but also at the consumer level.
Absolutely.
And especially when it comes to healthcare, trust and data integrity are so important, probably, more important than many other aspects of AI being used, right, in the consumer realm. So when you think about being able to deliver trust and have a trusted product that, both health plans, hospital systems, and their patients can use, what does that look like to you in Arcadia?
Well, first, I think it's the topic we're not talking about enough. There's always this joke of like, oh, I have a headache, I went on WebMD, and I have brain cancer.
Right.
And that's why trust matters, because people are turning to consumer solutions to try and help them understand their physiology, their health. And if these AI models aren't appropriately trained, you could really do like mental damage to a consumer. And also, we've got a supply and demand problem with access to care. If a patient's sitting at home thinking like, man, I've got like crazy cancer because OpenAI told me I have crazy cancer, because it put more demand pressure on the system that they can't respond to.
Yeah.
So as we think about trust, it really comes down to a couple of key points. The first being, one, how recent is the data? If the data that your AI is running on is a year, 2, 3 years old, it's probably too old.
Right.
Two, what data is it running on? If you're deploying a clinical AI solution and you're an integrated health system with multiple different clinical systems, multiple different care settings, and you're only getting data from one system, it's not seeing the whole picture. So how do you paint the whole picture? And then the third is, how do you provide transparency? So that if you're a provider and you have an AI assistant that's supporting diagnosis or computer assisted coding or care management, care coordination, knowing that was trained on data from your system that understands your market, that understands your region, is really important. How do you illuminate that and provide trust? And there's a lot of agencies, Chai and all the model card work, there's a lot that are focused on how do you elevate transparency.
And along those lines, I think what's amazing about the technology capabilities and what you guys are, continuing to evolve and build as well, is we're going to unlock a new level of access of care, especially in those regions which typically haven't had access to, let's say, a suburban academic medical center, what have you. What do you think about the opportunity and how data can, help move along and create the unlock, to rural communities that, those folks that are there will now have an opportunity to get, kind of world-class care, no pun intended.
To me, the work that's happening with the Rural Health Transformation Fund is a once in a multi-generation opportunity to
Yeah.
save the foundation of a lot of these communities.
Right.
People talk about bypass care. I live in a rural community. I've got a condition. I drive 50 miles to a suburban or an urban setting to get care because I don't
Yep.
trust my local care center.
Right.
That's a problem,
Yeah.
and that's a barrier to access to care. As I think about the opportunity in rural transformation, I think that rural hospitals are so well positioned to become the standard for how healthcare should operate.
Yeah.
Virtual first, alternative payment models deployed pretty broadly, whether it's capitation or otherwise.
Right.
And I think that this major national focus that Dr. Oz and policymakers in Washington have created with this Rural Health Transformation Fund is actually a really interesting moment. There are some critics of it saying it's only $50 billion and there's been trillions taken out of the system. That's all true. But what can also be true at the same time is that this energy where you have healthcare technology vendors who would otherwise not spend much time thinking about rural,
Right.
because we're all chasing these big integrated delivery systems,
Yeah.
are now saying, wait a minute, how do I think about the hundreds of rural and critical access facilities that need our help and our technology,
Yeah.
arguably more than someone like HCA. And
Yeah.
not to say that HCA doesn't need what we do either. It's just
Right.
it can be an and I think what's really unique about the moment we're in is you're going to start to see innovation around how do you bring the best technology, the best remote patient monitoring, the best payment models into rural communities. And all of a sudden, maybe will you flip the balance where the most innovative care settings are rural,
Yeah.
and they're drawing on the best capabilities from urban and suburban facilities.
Yeah. I think kind of, I agree 100% that it's transformative and it's along, with kind of your moniker, advancing health equity. I think,
Absolutely.
kind of being able to take that and take it into the field literally and be able to do that. Let's pivot for a second because this podcast is, hosted by Bradley Bostic, a serial entrepreneur and CEO, and we love to talk with leaders about leadership responsibility in a newer age work environment, right, where we have this transformative technology. How do you think about it in the context of leadership?
It's so hard. I first have to say it's hard to be in an environment where the pace of innovation is breakneck.
Yeah.
And every day you have to learn something new. And I think that that's really exciting in a lot of ways, like where you wake up every day and you're like, I'm going to learn something that I didn't know yesterday.
Right.
At the same time, you have to drive that learning and curiosity down into your organization. And leaders have a lot to drive transformation over the next 6, 12, 24 months.
Yeah.
You go from a place where in our business, we have a lot of software engineers who are writing code. We need them to direct agents.
Yeah.
I'm encouraging a lot of my operations leaders to go through an exercise. I'm calling it my white page exercise, where you take a blank piece of paper and I say, design the workflow for what you do with no humans in the loop.
Yeah.
In almost all cases, our risk tolerance, our security tolerance, our humanity tolerance does not rise to the level we would ever implement that. But we need to rewire our brains. And I got this idea. There's a book that I think McKinsey published called Rewired. It's all about how do you change the way you think as a leader to think about automation. And I catch myself all the time. There'll be things that I put off because I'm like, oh, this is going to take me so much time. I'm like, wait a minute. Instead of putting it off, why don't I just ask Claude Cowork to do this for me and see what happens?
Yeah.
Sometimes the result is not good. And I'm like, that's got to stay on my list. I have to either keep avoiding it or make time to do it. And sometimes I'm like, man, this is good. I was at a conference last week, had about 15 different meetings. They all required some level of follow-up. I took pretty good notes.
Yeah.
And just took my OneNote page. I gave it to Cowork and I said, I had all these meetings. Can you please draft me emails with follow-ups and sage them for me? did such a good job.
Yeah, I
Like,
know it's
just, I mean, that would have taken me a 6-hour flight to do because you get distracted and you start
right.
thinking about
Yeah,
things.
I know.
But just having something do that for you, and you're like, okay, that's moving the ball forward. And I think as we think about healthcare, I've been thinking a lot about how do we make our tools work better for us. I started my career in sales and marketing, and like a lot of sales and marketing professionals, Salesforce was like a necessary evil.
Right.
Did you see? You had to put your opportunity in, you had to update it.
Yeah,
The
it's
VP of sales would call you and be like, update Salesforce, I had a
yep,
board meeting,
yep,
and then
yep.
now, like I'm CEO, I do that. I call my head of sales, I'm like, update Salesforce, I had a board
Absolutely.
meeting,
Yeah.
and I had this big aha. I'm like, wait a minute. The whole point of Salesforce is not so I can report to the board. It's so that as a salesperson, I can manage multiple deals at the same time. If I take that hat off and I say, if I'm a physician, the point of the EMR is not to bill and code better, it's to manage your panel.
Right.
All these tools that we've fooled ourselves into helping us manage our pipeline, help us move a deal forward, manage a panel, manage a
Yeah.
patient, they're not doing it. And
Workflow. It's
it's
about workflow.
it's
Right.
about workflow. And
Yeah.
now it's like, oh wait, I can have a system as a provider where I've got an ambient scribe and I can have a conversation with a patient and it takes care of the administration.
Right.
The same thing is true like on Salesforce. Everyone has call recording turned on and transcript this and copilot that.
Yeah.
Do we need Salesforce? Like, why don't we just infer the stage of the deal based on like the APIs in and out of Outlook and what's happening on like our Gong recordings? And
Right.
you can be like,
Yeah.
this deal's moving or it's not moving.
Yeah.
And then use that to then send signals to the sales, professionals say, hey, this is what you need to do. So I think from a leadership perspective, we need to force ourselves to break from professionally accepted norms that you've got to use Sales for pipeline reporting, you've got to use Epic or Athena,
Yeah.
and you've got to be charting. So like, let's break those. And I was talking to a healthcare leader the other day. I was like, what if we just stop accepting that hospitals are going to operate at a low single digit operating margin? What if we say in 10 years, they're all going to be running at 15%?
Right.
And that's not because they're getting paid so much more. It's because they've adopted AI in a way that they've been able to really create meaningful efficiency. And then the question we have to ask is, if that's the case, how are they reinvesting?
Yeah.
Most hospitals are not for profits.
Right.
What are they reinvesting in? Does that mean that our clinical research is going to get that much better? I mean, if you think about just if every hospital had 15% operating margin and they were still not for profits, they're not returning dividends to shareholders, and they're like, I'm going to use that to reinvest in clinical research or new care models or new delivery technology.
Yeah.
Will we
Instead of
actually
just
crack the nut
right.
on health span? I mean, it's just the possibilities are endless. And so I've been really encouraging my team to say, throw the ball far down the field and like let's run towards it. Let's push and drag in some cases our customers there.
Yeah.
And by the way, we have customers who are pushing and dragging us there too.
Yeah. No, it's I'm a former hospital administrator, and I mean when you talk about efficiency potential, it's certainly at the top of the list relative to other industries. So as we start to close out here, if we were at HIMSS a few years ago, we knew about AI. We heard about some of the use cases. We heard about adoption across the board. But when you sit here today and kind of peek around underneath the hood a little bit, what excites you about the next 24 months? And it's not just AI. What other kind of opportunities are you seeing?
We've already talked about one, which is this Rural Health Transformation
Yeah.
Fund. I'm really excited about the opportunity to really transform the way care is delivered in rural communities. Our rural communities are really important.
Yeah.
And the hospitals in those communities are incredibly important. Oftentimes, your former hospital administrator, those are the largest employers in those communities.
Yeah.
And the entry-level jobs at those hospitals oftentimes pay the same as a fast food job.
Right.
And the big difference is upward mobility. The
Yeah.
number of people in rural communities who started as medical assistants, they got continuing ed, they're nurses or administrators. Like those are well-paying jobs with benefits that allow these people to stay in their communities and return to their communities. So I'm excited about rural. I'm excited about the elevated conversation at the national level about rural. I'm very excited about a lot of the work that's going on to free data and liberate data from core systems. A lot of Amy Gleason's work in the health tech ecosystem is pretty exciting. But more than that, I think, time has the person of the year. I think if healthcare in 5 years had a person of the year, it'd be the consumer. I think that the consumer is waking up. It's not accepting these norms that I have to wait for an appointment or I have to, Google things and it can't have access to my medical records. I think the consumer is going to be the one who unlocks a bunch of efficiency in healthcare.
Yeah.
And that's forcing collaboration. Payers, providers, life sciences organizations are all having to collaborate because the consumer is demanding it.
Yeah. Yeah. Excellent. Well, we'll end on that note. Certainly some nuggets there. Michael, thanks for joining us today, and continued success to you and the team.
Thank you so much. Thanks for
Okay.
having me.
All right. Thank you.